Hello, veterans and veteran champions. You or your loved one has back pain, and it might be worth up to 100% in VA compensation. I'm Chris, disabled veteran and founder of Operation Veterans Edge. Tap follow, hit like, and share this with one buddy who's hurting. I'm going to show you how that back pain can be compensable at 100% by itself in rare cases, and more often by stacking conditions your back pain causes. To my older vets, stop putting this off. I know the miles, the boots, the flak, the ruck. It's not just your age. That's likely your service connection right there. All that running you did in boots. Contact me today and let's get this done for you. Back pain reaches 100% in three ways. First, by itself, but only if the entire spine has unfavorable ankylosis, which means your neck and low back are stuck or fused in a bad position. Second, by stacking secondaries that your back causes until your combined rating hits 95 and rounds up to 100. And then third, individual unemployability. That's when your service connected conditions prevent substantially gainful employment, so the VA pays at 100%, even if your combined number is lower. In the next pieces, I'll show the exact stacks, legs, bladder or bowel, sexual function, mental health, hips and knees, and how to document them. Can the back alone hit 100%? Yes, but it's rare. Here's what the numbers actually mean. The VA looks at range of motion. That's how far you can bend. Forward bending at 30 degrees or less is 40%. If your entire low back is stuck or fused in a bad position, that's unfavorable ankylosis. The low back tops at 50%. And to get 100% on the spine alone, the entire spine must be unfavorably ankylosed. If your diagnosis is disc disease, the VA can also rate by incapacitating episodes. That means the doctor prescribed bed rest, and 6 or more weeks in the last year can be 60%, not 100. Most vets reach 100 by stacking secondaries or via individual unemployability. Let's talk about separate ratings for each of your legs. Don't leave the percentage on the table. Your back rating is just the start. Add separate ratings for each leg when the nerve is involved. Radiculopathy means a pinched nerve from your back causing shooting pain, numbness, tingling, or weakness into the leg. Each leg can be rated on its own, usually under the sciatic nerve. Example stack: a 40% back for limited bend plus left leg radiculopathy and right leg radiculopathy. Those percentages combine fast and push you toward 95% combined, which rounds you up to 100. Your exam should capture strength, loss, sensory changes, reflex changes, and foot drop if present. Make sure your doctor says it clearly in the notes. If you've got back problems, you may also have these other hidden issues like bladder, bowel, or sexual function issues. If your back affects bathroom control or sexual function, neurogenic bladder means the nerves controlling urination are affected. Urgency, frequency, leakage, pads, or catheter use. Neurogenic bowel means loss of control or severe constipation or accidents. These can be separately rated when a clinician ties them to your spine. Erectile dysfunction linked to nerve injury can qualify for Special Monthly Compensation K, SMCK. That's extra pay, not a percent. That stacks on top. Talk to your provider and get it in the record. Don't suffer in silence. If you have back problems, you might be dealing with two other big secondaries. Now for mental health and gait joints. Two more lanes that move the needle. Mental health and gait related joints. Chronic back pain can worsen depression or anxiety. When a clinician connects it, that mental health condition is rated separately and combines with your back percentages. An altered gait from the back can wear down hips or knees. If your provider documents the link, back condition, altered gait causing knee or hip degeneration, those joints can receive their own ratings. As a stacking example here, back, both legs, depression, and your knee can put you in the mid 90s combined, which rounds up to 100. Now, for your back, where you actually win is with the evidence and the exam tactics. Reaching 100% is one thing, documenting it is where you get the win. You need to make sure that you've got your diagnosis, not from just in service, but what's actually happening today. Ask for a medical nexus, that's provider opinion connecting your back to your leg nerves, your bladder, your bowel, your sexual function, your mood, your gait related joints. Bring all of this up at the exam. Make sure that you describe the flares, which means bad spikes and functional loss. How far you bend on bad days, how long you can stand, sit, walk, and what you can lift. If a doctor ever prescribed you bed rest, say it at the exam. Incapacitating episodes only count when ordered by a clinician. Be specific about nerve signs, numbness, tingling, weakness, foot drop. For bladder or bowel issues, be honest about leaks, pads, frequency, or accidents. Now, to recap all of this, back alone rarely hits 100. Stacking does. Legs, think radiculopathy, bladder or bowel issues, sexual function, mental health, hips or knees, plus strong exam language about flares and functional loss. If this helped, follow, like, and share it with one other veteran. And if you really need help, reach out to me at Operation Veterans Edge, where it's your benefits, your future, and it's our mission. I'm Chris. I'm looking forward to talking to you.